Hi, everyone. Welcome back to the show. This is the second installment of our series, Reviewing Your Results. If you haven't had a chance to listen to the previous episode, do take a chance to go back. It's talking all about your blood test when those come through on your patient portals. This episode, we'll be talking about the blood chemistry results, those lists of things that talk about your body's electrolytes, kidney function, and liver function. We're going to take a deep dive. Enjoy the show. Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. Everyone, welcome back to the Cancering Show. We are doing another episode on how to read your results. This episode, we are going to be talking about the chemistries, and you might see them on a lab report as a BNP or basic metabolic panel or a CMP or complete metabolic panel. But it's all those funny abbreviations that you may or may not know what they mean. And this is an attempt to give you a very brief overview, and it's really not going to be that brief, but we're going to be as brief as we can, but a brief overview and introduction into what some of those symbols and abbreviations mean, so you can help your doctor to better understand maybe the history that could have led to any of those abnormalities, and you know what questions to ask. But I want to start by saying, every doctor who reads your lab report in less than 5 seconds and notes that there are no abnormalities is doing their job right. And they are correct that that is all good news. When it says it's normal, it is normal. And they can look at those lab reports in a very quick way and say, okay, well, your salts are normal, your kidneys are working fine, your liver is working fine, and you don't have diabetes. And they can do that really quickly. And that's what they should be able to do. A long time ago, a friend of mine said to me, as a gynecologist trying to read an EKG, that listen, if the machine says it's normal, then you're fine. But if the machine says it's abnormal, that doesn't necessarily mean there's something wrong with the patient. It just means that maybe we need a little more information to determine the true abnormals or the worrisome things from the reasons that might be a false positive or a false abnormal test. So I'm going to say the same thing to you about these chemistries. A lot of times when there is an abnormal, the first thing I want you to do is look at what is the normal range. If it's 0.1 or 0.2 off of the normal range, nobody is worried about that. So you should not be worried about that either. But for things that are further out of range, it is helpful for you to know a little bit more to help your doctor determine why it might be abnormal, and also for you to know what questions to ask. So let's dive in. All right, here we are looking at the chemistry panel, and I'm going to do this in 3 segments. So the first is the Na. You might see it listed as SOD, or you might see it written out as sodium. Na is the periodic table symbol for sodium, and so it's sometimes written as that. Now, your sodium is the salt in your blood. It's also the salt you put on your food. And when we think about sodium chloride, it's the salt we give you in IV fluids. So it is very important to your sustained life on Earth, and 70% of our bodies are literally salt water. So we know that it's important, but it is also the least likely to be abnormal. The vast majority of people are in the normal range, 135 to 145, and that is true even for people who can be critically ill. Now, for someone who has a very low sodium, we see this in 2 times. First, when they're entirely dehydrated of both salt and water. For example, somebody who has significant nausea and vomiting, somebody who has excessive sweating or heat stroke. And then, of course, in people who have not been eating and drinking appropriately. The other time that we see an abnormally low sodium is when people are drinking too much free water and not enough salt. And so there are different corrections for those 2 things, but those are the basic things. You might ask what I mean by free water. That means water that doesn't have any electrolytes in it. And so for any of you out there who are finding yourselves dehydrated because you just were outside in the garden, walked a mile in the 100-degree heat this summer, or because you have been throwing up or having diarrhea, we always recommend that you replete those fluid losses with some type of electrolyte fluid. So the best fluids out there, we know the Gatorade and Propel that were designed to replete the losses related to exercise, but also the Pedialyte, which is specifically designed to replace fluid and electrolytes from GI losses, like a child who has had a GI bug. Next, let's talk about the other two salts in your blood that you may not recognize as salts. The K, or potassium, on the report, and K is the scientific symbol for potassium, or mag, or magnesium. So a lot of times when your body is losing a lot of salt, it will also trade out the potassium or magnesium to keep more of your sodium. And so what we see most commonly when people are dehydrated is they are low on all three. Or probably if they're managing somewhat to keep their sodium normal, then their potassium and magnesium are low and need replacing. Also, sometimes people with kidney disorders can what we call spill their potassium or magnesium, what we call a salt wasting disorder, where their potassium and magnesium spill out in their urine even when they should be keeping it. And for those patients, they do need some type of potassium or magnesium repletion. That means taking a supplement by mouth or eating foods that are high in potassium or magnesium in order to replace them. And if you find that you are getting a potassium or magnesium replacement in either fluids or by mouth prescribed by a doctor, it might be worth asking the question, is this something I'm going to need to take forever? Is there a medication that I'm taking that would, result in me having less of these? Is there maybe a supplement that I could take or a food that I could eat so I don't have to take as many supplements? The third one we're going to talk about are two together as well, what we call the BUN and the CR, or creatinine. Now, both of these refer to the kidney function. The BUN is less important, but speaks somewhat to your dehydration. And the creatinine is the amount of the toxin, creatinine, that is usually processed in the kidney. So when that number is high, then we know that the kidney is not functioning as well as it should. Now, keep in mind, sometimes it can also be high when you're very dehydrated and your kidney can't filter as much water because it's trying to conserve water. And so for either of those circumstances, we again would encourage you to ask your doctor why they think that your kidney function might be off or why they think that your creatinine might be elevated, keeping in mind that 0.1 or 0.2 off of the normal range is not significantly concerning. A brief note about both of these: we worry very little when these are low. That can actually mean you're very well hydrated. And for some patients, or for older people in particular, it can indicate some version of muscle loss that leads to these numbers being kind of below average because a person doesn't have the average amount of creatinine that is streaming through the body. But a low normal or something below normal is not something that we worry about. I will also mention that for pregnant women, being below the normal range is, of course, normal because we significantly increase the water in our bodies at the same time. The last thing I'm going to talk about in the basic metabolic panel is the glucose. Now, everybody knows that glucose is a sugar that our bodies use to burn and have energy. And it's also mainly from our food. And our bodies, if we are not diabetic or have another related glucose disorder, then our glucose should always be in the normal range. So your body, regardless of what you had that day, regardless of what you did or didn't eat, your glucose should be in the normal range. And normal is anything less than 140. And that depends a lot on how recently you last ate and whether that was a chocolate bar or an apple. But anything in the normal range, totally fine. So let's talk about when your glucose is over 140. It depends on when it is and what it is and what you had to eat prior to that. But an elevated blood glucose does indicate a possibility of being pre-diabetic or diabetic. And anything above 200 is an automatic diagnosis of diabetes, no matter how often or how rarely you end up in that range. And so anytime we see elevated blood sugars, you want to talk to your doctor about that. Ask what you can do to get it lower. We know that sugar, while it fuels our bodies, also fuels cancer. And so we want people to be in the normal range, even if that means that they start on some type of diabetes medication or diet-controlled intervention to lower that blood sugar back to the normal range. The number one thing you can do if you find that your blood sugars are significantly elevated on your lab results is talk to your doctor and talk about monitoring it more closely between lab visits. Let's talk for just a second about low blood sugar. It's incredibly rare, usually associated with some type of alteration in normal body chemistry. So that might be that you're taking a medication that lowers blood sugar, or we see that sometimes in pregnant women. But the vast majority are related to diabetic patients who maybe are on a blood sugar lowering medication and have not had breakfast. Anytime we see a low blood sugar and the lab calls me, I'm like, where's the patient? How's she doing? How's she feeling? And then, of course, we recommend that you have a snack or juice to get that blood sugar back to the normal range. And every episode of low blood sugar should have some sort of intervention to look into it and see why your blood sugar could be getting low. Is it that you do need to have meals more frequently, or could it be related to some medication? Next, I'm going to talk about a group of labs that you might see on your complete metabolic count, all as one group. So this includes the labs labeled as liver function tests. You might see abbreviations like ALT or AST. These are the two transaminases. Don't worry, you don't have to write that down, or what we call liver enzymes, that if the liver is inflamed, then these might go up. Liver inflammation can be caused by almost anything: a binger weekend, time under anesthesia, or it could be related to chemotherapy or cancer treatment. It can also be related to cancer progression, although that's much more rare. So these just indicate how the liver is, quote unquote, feeling, not really how the liver is functioning. One of the things we'll always do if we see those labs to be abnormal is check for hepatitis, which we know is a viral infection of the liver. And that's the first thing we look for, although a very rare cause of an abnormality in these labs on a given day. The other thing you're going to see on those liver function tests are the measurements of your bilirubin. The bilirubin has a T-bili or a D-bili. Both of these refer to bilirubin in your bloodstream and go to the question of how is the liver actually functioning? How is the liver processing the bilirubin, which comes from the breakdown of red blood cells? And that bilirubin is what makes people jaundiced. So if you are jaundiced, or you as a caregiver notice that the patient is jaundiced, that likely indicates an elevation in their bilirubin and that the liver is not functioning well. This can happen very acutely if there is a clog in the liver filtering system and would require emergent treatment at the hospital, or it can happen very slowly and chronically, as we see with diseases like cirrhosis. So it really depends on how acutely you notice the rise in bilirubin or the jaundice occurring. But anytime you see jaundice, and what I mean by that is a yellowing of the eyes and the skin associated with that buildup of bilirubin. And the reason you know that yellow and the bilirubin are related to the breakdown of red blood cells. Remember in a bruise starts as that red, almost purple, that looks like a blood cell that's been smashed on the floor. But then as it breaks down, it turns green and then yellow. And so that's that breakdown product of the red blood cell. So we're thinking about how is a liver functioning. The vast majority of the time when you see these labs, you'll note that those numbers are normal and that the liver is functioning well. The last thing I'll mention on this list of liver function tests is the albumin. And the albumin is the protein in our bloodstream. Again, most of the time it is normal, even for somebody who has had a prolonged time, maybe days without eating. It remains normal because our body has lots of things in storage that it can pull out to create more protein for our bloodstream. And the protein is the sponge. It holds the water into the blood vessels so that it keeps circulating instead of filtering out into the extracellular tissues, like when you have swelling in your ankles from being in the hospital a long time. And so when we notice that the albumin is low, then we're going to talk to you about what you've been eating lately, whether or not we could increase your protein, and how we can make sure that you get protein as part of your calories and not just things like carbohydrates. If you're looking to increase your protein, there are very straightforward ways to do that. We always talk about, and I'll refer you to our diet episodes to learn more about this, but we always talk about increasing the protein-rich foods, meats, the obvious choice, eggs, peanuts and peanut butter, and beans. So there's lots of ways to increase your protein. Sometimes we even recommend protein shakes like the over-the-counter Ensure, Glucerna, etc. Or if you need it, even protein powder, and make your own shake. So lots of different ways to increase that protein. Those are the main components of the complete metabolic panel. I'm going to mention very briefly 2 other tests that you will see commonly on your labs. For those of you who are listening to this who maybe don't have cancer or cancering but are seeing your primary care doctor, you might notice a lab called HbA1c. And for those of you who are diabetic, you're probably familiar with this. That is the hemoglobin A1c. It is the amount of hemoglobin that is elevated when people's blood sugar is elevated. And so when we think of the HbA1c, it doesn't just measure your blood sugar or your glucose that day or that minute. It measures what your blood glucose has been doing over the last 3 months. So it tells your doctor if you were good and had all fruits and vegetables and did your walking, or if you ate cakes and cookies and hung out on the couch. So it's going to tell on you. So you always want to be sure that when you're preparing for one of those tests or you're going to see your doctor, that you're ready and you've done the work, not just for 3 months, but all year long. Last, let's talk about the TSH. I think that this lab test is on the rise in terms of our results, but also on the rise for our cancering patients as well. The TSH is the thyroid stimulating hormone. It's a test of how your thyroid is functioning. But the test works in the opposite direction that most people think. So it is the thyroid stimulating hormone. So when your thyroid is functioning normally, it is low because it doesn't need additional stimulation in order to work well. When your thyroid is overactive, your TSH might actually be very low, dangerously low, or undetectable. And that might mean you have an overactive thyroid. And when your TSH is high or very high, that means that your thyroid is not functioning well. And you might need to take thyroid hormone replacement medication. Now, why do we do the TSH for cancering patients? We've talked about the fact that immunotherapies, more and more common throughout people's cancering journey and more common across all cancer types, are on the rise and can cause thyroid problems. So when we are giving patients immunotherapy, we're also following their thyroid function and treating any thyroid abnormalities that come up. So that's it for today. I know that was very intense. I recommend that you maybe pause it in between, listen to it a couple of times, or skip it completely if you really don't have a great interest in what all these results and acronyms mean. But for those of you who are curious and look at those results every time as hieroglyphics, I hope this gives you a roadmap to better understand it. If you like this episode, I encourage you to go back and listen to the previous episode on reviewing your CBC results. On the next episode, we're going to be talking about how to review your pathology reports. Until then, keep cancering and take care of yourselves. Thanks again for listening. And don't forget to submit your questions at www.cancering.com. We're here for all of those questions and we'll get you the answers. This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people. with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.